Hello students, I am Dr. Reethika Rathan, Assistant Professor from the Department of Oral Medicine and Radiology, Vinayak Mission Sankaracharya Dental College, Salem. Today I am going to discuss on the topic magnetic resonance imaging, that is MRI. These are the contents which I will be explaining in my further slides. So, magnetic resonance imaging has revolutionized medical imaging by providing detailed high-resolution images of soft tissues without ionizing radiation. While MRI is extensively used in neurology, orthopedics, and cardiology, its role in dentistry is emerging as a promising tool for diagnostic and treatment planning purposes. MRI is used as a non-invasive method for mapping the internal structures and certain aspects of the functions within the body. It uses a non-ionizing electromagnetic radiation and it does not cause any exposure-related hazards. It uses a radio frequency radiation in the presence of an electromagnetic field that produces a high-quality cross-sectional images of the body in any plane. So now we go about to the history of MRI. So initially MRI was termed as NMR, that is nuclear magnetic resonance. So initially it was evolved in the year of 1924 by Pauli, who studied nuclear particles that have angular momentum, and in 1937 by Rabi, who studied the measurements of the magnetic momentum of nucleus and termed as magnetic resonance. Here only the magnetic evolution was taking place, and in 1944 the Rabi got Nobel Prize in Physics, and in 1946 Edward studied matters to absorb energy at a resonance frequency, and in 1946 Bloch studied nuclear precision, and so they both got Nobel Prize in Physics at the year of 1952. In 1959, Singer studied the measurements of blood flow using NMR, and in 1972, Damadian got the patent idea for a large scanner, and in 1973, Paul published generating images using the NMR gradient, and in 73 Peter published the gradient approach to NMR, and this is the area where the NMR becomes MRI. So in 1975 Ernst developed 2D Fourier transform for MR, and in 1985 an insurance reimbursement for MRI was begun, and in 1980 1.5 Tesla and 2.0 Tesla superconducting MRI was developed by Goldstar and Co. And in 1990 Ogawa and Co. obtained a functional image using a bold contrast. Bold contrast is nothing but blood oxygenation level dependent contrast, which is used to find the activities that is occurring in the brain. And in 2005 ultra high field 7.0 Tesla MRI was developed by Harvard and Co. And in 2003 Loberster and Mansfield got Nobel Prize in Physiology and Medicine. In 2008 PET MRI was developed, and in 2012 11.7 Tesla MRI was developed, and in 2014 MRI LINAC was developed, and now it is evolving and MRI is getting into AI implementation. The principle of MRI: the patient is first placed in a large magnet that possesses a magnetic field. Due to this magnetic field, the nuclei which are present in the body, that is more amount of atoms, that is the hydrogen atom particularly, gets aligned with the magnetic field. Then the scanner is directed by a radio frequency pulse into the patient, which causes the hydrogen nuclei to absorb energy. So when a radio frequency pulse is turned off, the absorbed energy is emitted and it is detected by the signals in the scanner, and this scanner is used to construct the MR images. The working mechanism of MRI is basically with the importance of protons, precision and resonance. So first we go about with the protons. So protons and neutrons in the nuclei of the atom possesses a spin. The equal number of protons and neutrons have a net spin of 0, and unpaired protons and neutrons have a net spin. So, a hydrogen nuclei consists of a single unpaired proton. So, the magnetic dipole are randomly oriented in space. This causes that the arrangement of the protons are in direction to the electromagnetic field. So, there are two patterns of direction noted during the electromagnetic field direction. So, the spin up and spin down. So, spin up is nothing but the magnetic momentum is in direction with the electromagnetic field, as you see in the right corner of the image. So, that is the spin up direction, and spin down is nothing but the magnetic momentum is against the direction of the electromagnetic field. Next is the precession. Usually, nuclei do not align exactly with the direction of the magnetic field. Instead, with a slight tilt from the position which is absolutely parallel to the magnetic field and spins around the axis. This tilting of the spin is called the precession. So, the rate of frequency of precession is called precessional frequency, resonance frequency, or Lamarck frequency. Resonance. So, this image on the left, first image, shows the longitudinal magnetization vector. So, as I said before, when magnetic field applied, the protons get to align as a spin up and spin down. When radio frequency pulse is absorbed by the proton, they causes the low energy nuclei to go to a higher energy state, causing the longitudinal vector, that is, as you see in the image, the longitudinal vector is reduced in size. So, by increasing the intensity and duration of the radio frequency pulse, the longitudinal vector changes to the direction of transverse vector. So, in this area, the magnetization is maximum as the nuclei are arranged in one phase. As I said before, see in the first image, the nuclei are randomly arranged in orientation. So, when the radio frequency pulse is directed, they are aligned to one plane, as you see in the image. So, this is called as 90-degree radio frequency pulse or flip angle pulse of 90 degree. Next is the magnetic resonance signal. So, there are two signals, that is weak and strong signals, that can be detected. So, tightly bound hydrogen atoms mostly produce low signal, that is weak signal. So, examples are hydroxyapatite in bone. They do not align themselves with the external magnetic field, so they produce weak signals. And so, the loosely bound atoms produce a detectable signal as they align with the direction of the magnetic field, for example soft tissues and liquids. So, the concentration of loosely bound hydrogen nuclei and these signals are termed as proton density or spin density. And when the radio frequency pulse is turned off and the nuclei begins to return to its original state, and this process is called as the relaxation stage, and the dephasing results is called as the decay, and reduced voltage inducing the reversing coil is called as a free induction decay. Next is a T1 relaxation. It is also called as a spin lattice relaxation. So, here it measures the time taken for protons to realign with the magnetic field after the radio frequency pulse is removed. So, that is the term. It is given as spin lattice relaxation time. So, long T1 is seen in CSF and short T1 is seen in bone marrow. So, next is the T2 relaxation. So, T2 relaxation is nothing but it measures the time taken for protons to lose phase coherence, that is the rate of loss of transverse magnetization takes place, and this is called as a spin relaxation time or T2 relaxation. So, long T2 is seen in tissue with more fluids and short T2 is seen in fatty tissues. Next is the radio frequency pulse sequence. Here we can see there are TR and TE. TR is repetition time and TE is echo time. TR is nothing but that is the duration between the repeat of radio frequency pulse, and TE is the time after application of radio frequency pulse and when the MRI is detected. So, signals are detected. So, the duration between the radio frequency pulse and the MRI signal is called the TE, echo time. Tissue contrast mainly governs by intrinsic features of the tissue. So, it includes proton density, T1 and T2 times of tissues being imaged, and how the TR and TE times are adjusted to emphasize these features. So, when the tissues have high proton density and strong transverse magnetization at TE will produce a bright appearance on a magnetic resonance imaging. So, because of the strong signals they produce, whereas low proton density or low transverse magnetization vector at TE produce weak signals and they appear as dark on the image. The T1 Wade image is mostly used to demonstrate the anatomical structures and it is accomplished by short TR and short TE. So, short T1 is in fact is seen as bright and long T1 in CSF is seen as dark image. So, in T2 Wade image, it is mostly used in identification of pathological structures and it is accompanied by long TR and long TE. So, short T2 in fact is dark and long T2 in CSF or TMJ fluid is bright in appearance. Contrast agent plays a vital role in differentiating the soft tissues and how to identify from normal and abnormal tissues. So, the contrast used in MRI is gadolinium, as it is a paramagnetic substance and has a shortened T1 relaxation time which makes them appear brighter. So, mostly it is used to enhance the normal tissues as well as the pathological tissues include neoplasm, infections, inflammations and post-traumatic lesions in pathological tissues, whereas in normal tissues, vessels with slow flowing blood, muscles, etc. And it is mostly administered intravenously to improve the tissue contrast. Next is the scanner gradient. So, here in MRI there are three gradients, that is X gradient, Y gradient and Z gradient. So, the coils are present inside the gradients that produces the image, so that detects the signals and produces the image. So, here the X axis and Y axis and Z axis are the planes that correlate with the gradients. So, X axis, X is from the left to right and Y is from the anterior to posterior and Z is from the head to toe. When RF pulse is applied, which allows selecting the desired tissue images in Z gradient coil. So, the location of the signal within the X and Y plane is later identified by switching off the Z gradient followed by rapidly switching off the X gradient followed by Y gradient. Artifacts. There are image processing artifact. So, first is the aliasing or wrap around. So, this is nothing but if the image is not in the place of a field of view, then the image appears in the opposite end of the image. So, as you see in the first image, you can visualize the opposite end of the image in the scan. So, then is the chemical shift. It appears as a dark or bright bands due to the interference of liquids. Next is the truncation artifact or Gibbs phenomenon. It appears as an alternating bright and dark lines and appears as a ringing effect. Partial volume artifact occurs mainly due to the loss of resonance. Next is the patient related artifact, motion artifact. Mainly if the patient moves voluntary or involuntary, then the motion effect is occurred. And magic angle artifact, if the tendon is oriented at an angle of 55 degree, then the tendon appears brighter in T1 and but normal in T2, as you see in the image. Radio frequency related artifact, crosstalk. It is due to the imperfect shape of RF slice So it usually appears as a rectangular, but in our artifact it appears as a curved shape. And zipper artifact, it is due to the excitation of RF pulse is not completely gated off during the data acquisition. So then RF noise is due to the unwanted external noise produced. Then external magnetic field related artifacts. So magnetic inhomogeneity, it is due to the improper shimming, environmental factors that causes the artifact. And magnetic susceptibility artifact, it is mainly due to the metal. So this causes the distortion in the scan. Gradient related artifact, eddy current. So here the small electric currents are generated by during the rapidly switching on and off of the signals. So as you see in the image, there are small electric currents that generate the eddy current. So then is the non-linearity that which is caused by local magnetic distortions and image artifacts. Then is the geometric distortion, that is due to the gradient power drop off. And errors in the data, it is due to the errors in processing of data during the calculation. So signal calculation. And dielectric effect are nothing but when the wavelength of the radio wave approaches the dimension of the body, then it appears as a brighten and darkening due to the outstanding waves. The applications in maxillofacial diagnosis. So MRI can be used in evaluating the position and integrity of the TMJ and evaluate the neoplasms of oral cavity and jaws, and it can be also used in evaluating the salivary gland diseases and vascular lesions in the orofacial region and evaluate suspected early osteomyelitis of the jaw and assessment of the intracranial lesions, tumor staging and implant assessment. The advantages of MRI, ionizing radiation is not used. So here, as I said before, MRI only uses a non-ionizing radiation and no adverse effect is seen. So as it does not use any ionizing radiation, so exposure related hazards are not possible, and non-invasive and image manipulation is available, and high resolution images can be constructed in all planes, that is using 3D volume technique, and excellent differentiation between the soft tissues, that is normal and abnormal, is well appreciated, and it is useful in determining intramedullary spread malignancy. Disadvantages: the equipment tends to be claustrophobic and noisy, as only the patient is allowed in the scanner area, so the patient might be fearful. So because of that also patient might feel claustrophobic and the noise generated. So and the scanning time is long and the equipment is very expensive, and it is contraindicated in patients like the patient who have pacemakers, cardiac pacemakers, surgical clips and in pregnancy state, and metallic objects like endotracheal tubes or dental implants can be replaced by a non-ferromagnetic alternatives, and bone, teeth, air and metallic objects all together appears as a black, and so it is very difficult to identify or differentiate between them. The advances in MR imaging: flow imaging, that is MRI, angiography, MRA. So it is used in high resolution imaging of oral blood vessels and helps in diagnosing vascular lesions and tumors. It also aids in the surgical planning. Next is the MR elastography, that measures tissue stiffness and helps in detecting oral cancers and TMJ disorders. And it also helps in the assessment of fibrosis in oral mucosal lesions and in salivary glands. So next is the MR xylography. It is a non-invasive imaging of salivary glands and ducts. It is mainly used in salivary gland disorders, that is like Sjogren's syndrome and salivary gland tumors. Next is the MR spectroscopy. It uses in analyzing the biochemical composition of tissues and helps in differentiating the benign versus malignant lesions. Then high resolution MRI, that is 3 Tesla and 7 Tesla. So here it causes improved image clarity and early detection of the dental and TMJ conditions can be appreciated and better diagnosis of the soft and hard tissues are possible. Then functional MRI. It is helpful in assessing the brain responses and helps in understanding bruxism and TMJ disorders, and also it monitors the nerve function and pain pathways. Black bone MRI and ultra short echo time MRI. Here it is helpful in visualizing the hard tissues like jaw bones and teeth. Then is the diffusion weight imaging and diffusion tensor imaging. So here it detects the oral cancer and inflammatory condition that helps in diagnosis of also trigeminal neuralgia and also helps in mapping the nerve pathway. Next is the hybrid imaging technique, that is PET MRI and MR-Linac. It is a recent development where the PET MRI combines metabolic imaging with high resolution MRI to detect early stage oral cancers, osteonecrosis and inflammatory conditions. MR-Linac, a fusion of MRI and radiation therapy, allows real-time tumor tracking during radiotherapy, improving treatment outcomes for head and neck cancers. And the last is AI in MRI interpretation. So here it enhances the image reconstruction and helps in analyzing so that it reduces human error in diagnosis and automated segmentation of the dental tissues. So to summarize, MRI, that is magnetic resonance imaging, as the name gives the meaning, magnetic, that is the patient is placed inside an external magnetic field which causes the hydrogen nuclei to align to the magnetic field, and resonance, when radio frequency pulse is turned on, that causes the nuclei absorbed energy and align in spin up and spin down direction. When radio frequency pulse is turned off, the absorbed energy by the nuclei is released to the coil. Then I, that is imaging, the released signal is received by the coil which is transmitted to the computer and the MRI images are obtained, and thus it is put together as magnetic resonance imaging. Thank you.